You know, it's interesting that most of the focus in cardiology for probably the previous 20 years was really on innovation in coronary artery disease and stents and medicated stents. And that became a fairly mature field and very durable, predictable results that we get now with medicated stents. And the valvular area was essentially not well investigated. And what really changed things was the excitement, the innovation, and the reliability that we've seen in the aortic valve area with the stented valves that have been utilized. And just at this meeting, obviously showing that transcatheter valve therapy was superior to surgery as far as death and stroke rates. And with that degree of success and innovation, people began to look at what other valvular lesions could be effectively treated with catheter-based therapies. And then therefore the innovation now in the mitral and the tricuspid area as well. Well, that's a good question. First of all, I would just want to keep the terminology straight. It's interventional cardiologists that are primarily driving a lot of this therapy. Cardiac surgeons have also been involved with this as well. So it's really been a heart team approach, if you will. I am an interventional cardiologist, not a cardiac surgeon, and so we've been doing catheter-based treatments our entire career. Cardiac surgeons are also becoming facile with these technologies as well, because I think people recognize that we want to design the best therapy for every patient, and some of those may be catheter-based, and sometimes it still may be open heart surgery. And therefore, the heart team approach, which we've used here at Northwestern for many years now, where we review every patient and decide, is this patient best treated with catheter therapy? Are they best treated with open heart surgery? Or sometimes a combination of the two are the best. But it certainly requires continued education, skill enhancement, and learning, which is really what makes the field so exciting. Is it's been just a rapid innovation over the last number of years. So it's primarily by training. We cardiologists can choose to go into interventional cardiology, which is learning catheter-based skills, and cardiac surgeons traditionally did more open heart type procedures. And what we now see is more of a blend where some of the cardiac surgeons are learning to do catheter-based skills, and the cardiologists that knew those skills are extending those skills into other areas of therapy. Look, I think the most exciting thing for me in cardiology for my career has been that innovation continues throughout, and the things that we never thought were possible, like what we're discussing here today, are now possible today. But are we at a static state? Absolutely not. We're clearly moving forward. This is one therapy for tricuspid disease. There's others that are also in development. Just like we talk about mitral disease, there's over 15 different innovations and technologies out there that are being assessed right now. What ultimately will be the best treatment for mitral disease is not really known. I think aortic has become more mature, and we've really landed on a couple to three technologies that really look fairly durable and look like something that we can move forward with for a fairly long period of time with excellent results. Yeah, so that's a very good question. Since this is really in an early feasibility stage, there's only a few centers in the country that are offering this. So I would recommend patients that have been diagnosed with this problem that they seek out centers that are really looking at new technologies as well as traditional surgery, as well as medical therapy, because they really want to be designing what's best for that one patient. So I would encourage patients to look on the internet, look at what centers are offering these treatments and trying to understand what may be the best for them, because it could be any one of those. This may not be the best for everybody. It clearly isn't the best for everyone. But for those that it is best for, it's nice to be able to offer that. You know, it's really one of the most exciting things to be able to help people on the cutting edge. And really that's what the excitement is, be able to have the new technology, be able to apply it effectively and to really help people in a way that in the past they were left with poorer lifestyles or poorer prognosis and not many options. So it's really what drives us, I think, is to be kind of on the cutting edge.